Hello friends, welcome back to Dog the Best Friend channel. Come on friends, today we will know more about canine parvovirus disease. Parvo is a highly contagious viral disease of dogs which causes acute gastroenteritis in puppies. Usually, disease strikes the puppies from 6 weeks to 20 weeks and unvaccinated adult dogs. In a few puppies, parvo causes infection of heart muscle which could be fatal. Parvo affects all breeds of dogs, but few breeds like Rottweiler, Doberman, German Shepherd, Labrador Retriever, and few breeds of Spaniels and Terriers are vulnerable to the disease. When the puppies are weaned, they will be under stress, and if infested with parasites, they become prone to the parvo disease. The canine parvovirus first emerged in Europe in 1976. From then on, it has spread globally. Canine parvovirus can be found in almost any environment, but not every puppy which comes in contact with the virus becomes infected. The immune system of the puppy and the number of viruses the puppy is exposed to play a role here. If the combination of factors is just right, the puppy gets the disease. Incubation period. After the entry of the virus into the body, in 3 to 7 days, puppies show symptoms of the disease. The virus enters the body through mouth or nostrils and reaches lymphoid tissue. After multiplication in lymphocytes, the virus reaches bone marrow and intestinal epithelium through the bloodstream. The virus in the bone marrow reduces the white blood cells, thus bringing down the immunity further. The virus destroys the epithelium of small intestine, which facilitates the bacteria in the intestine to reach the blood. Death in parvo is due to dehydration along with effects of septic toxins produced by the intestinal bacteria in the blood. When parvo affects heart muscle, death is due to cardiac failure. Symptoms. Symptoms of parvo include lethargy, depression, loss or lack of appetite, followed by fever, vomiting and diarrhea. Watery diarrhea turns bloody with foul smell as disease progresses. Diagnosis. Depending on the symptoms, your doctor can diagnose the disease. If need be, a simple measure of white blood cell count helps. Reduced count of white blood cells indicates the parvo infection. Treatment. Treatment involves supportive care and management of symptoms. Treatment options will vary depending on how sick the dog is and what the symptoms are. Infusion of intravenous fluids is necessary to replace the quantities lost through vomiting and diarrhea. Medicines to control nausea and diarrhea are sometimes useful. Antibiotics are administered to help fight the infection. All the medicines and nutrients may have to be given through injection or intravenous drip only, since the disrupted intestinal mucosa may not be able to absorb these if given orally. If the blood count is too low, blood transfusion may be necessary. Many dogs will respond well to the treatment when initiated in time. Prevention. Puppies get the antibodies from mother's milk. By the time the antibody levels start dropping, puppies should be vaccinated so that they get the antibodies of their own. Vaccination should start from 6 weeks of age. Usually, puppies are protected by a single multi-component vaccine against distemper, hepatitis, leptospirosis, parvo and parainfluenza diseases. Puppies and adolescent dogs should not be taken to public places where dogs congregate and may contain viruses until their vaccinations are complete. The puppy should not be taken for a walk to place where dogs have defecated. The infected dogs will be shedding the virus continuously after recovery. The parvovirus, unlike other viruses, is very stable in the environment and is capable of surviving for months outside an animal. Even without direct contact, the virus can be carried on the hair or feet of dogs and shoes, clothes of human hosts. So, once infected, parks, lawns, houses become the sources of infection. Though sunlight and rain reduce the concentration of virus in the yard over a certain period, effective disinfection of the houses is necessary to avoid infection. We will see how to disinfect houses, yards and how to take care of parvo dog at home in the next video. Parvo is a highly contagious and fatal disease. Thorough disinfection of the area and regular vaccination is the only way to protect the puppies. Friends, this is about parvo infection in puppies. If you like the information, please hit the like button. If you have not yet subscribed to the channel, please subscribe now And with this, I, Dr. S. P. Ravikumar, conclude this video. See you in the next video. Namaste.